You have joined the gym, bought new shoes and told everyone on WhatsApp, BP ka full stop. A week later, your trainer says, bro, you need to push heavier. Your wife says, don't strain too much, BP बढ़ जाएगा. And you are wondering if your heart is exercising or waiting to explode. Namaste, I am Dr. Ameya Amonkar and welcome back to Cardiowise. Every week I meet people who think exercise means safety. But did you know that during certain workouts, your blood pressure can shoot to up to 250 millimeters of mercury? Yes, you heard me right. This is a scientific fact and most people never even realize it's happening. While it is true that exercise is one of the best medicines for high blood pressure, but even medicine has a dose. Some workouts done wrong can spike your BP instantly, while others protect your arteries for life. Today, I'll show you exactly which exercises can silently raise your blood pressure and how to make them safe so that it strengthens your heart without stressing it. So let's dive in. Let's get one thing straight. Exercise is fantastic for blood pressure in the long run. It strengthens your heart, opens up your arteries and reduces stress. But in the short term, certain exercises can make your BP spike instead of drop. Why? It's not bad luck, it's simple physics and physiology. Now let's take an example. You're doing a heavy squat or lifting weights. You brace yourself, hold your breath, tense every muscle and push. At that moment, your chest pressure increases, your arteries tighten up and your heart is pumping against a wall of resistance. The result, BP can shoot up to 200, even 250 millimeters of mercury for a few seconds. That's like having a mini pressure cooker which you forgot the gas on and your arteries are the cooker whistle about to blow. Except here there's no whistle, just silent strain. And now an athlete's heart and arteries, they're trained to handle these momentary spikes. But for someone with hypertension, thickened heart walls or on BP medications, that same strain can trigger dizziness, headache or even a small vessel tear. Think of your blood vessels like pipes in an old Mumbai apartment. If you suddenly blast the water full force, the old joints may leak, not because the water is bad, but because the pressure is too much for the system. And here's the real culprit, it's not the exercise itself, but the way you breathe and strain. When you hold your breath during a lift, that's called the Valsalva maneuver. So pressure inside the chest rises, it reduces blood venous return to the heart. So when you suddenly release it, blood rushes back and the BP spikes even more. So if you have ever gone red in the face mid-repetition, that's not your muscles talking, that's your arteries protesting. Let's start with the usual suspects, the heavy weights, deadlifts, squats, bench presses, overhead presses, the stuff that make the gym echo like an action movie set. Now don't get me wrong, strength training is excellent for health. It builds muscle, burns sugar, strengthens bones and even helps long-term BP control. But during those few seconds of intense effort, your blood pressure can shoot up faster than Mumbai's rent prices. Now why does this happen? 3 reasons. First, you hold breath. That's the Valsalva maneuver again. Chest pressure rises, blood return to the heart falls and the heart has to push harder against the closed valves. Second, you lift too heavy, more than 70% of your max. To give you a quick understanding, your 1 rep max is the heaviest weight you can lift for one single repetition with proper form. Now it's your absolute maximum effort. After that, you can't lift again without rest. Now this 70% figure comes from exercise physiology research. At that point, your muscles are screaming for oxygen and your arteries tighten to stabilize. Now beyond that intensity, the body activates more straining, breath holding and pressure spikes. Third, you rush your reps. See, rapid repetitions with poor breathing rhythm keep adrenaline high and pressure locked in. So for people with hypertension, left ventricular hypertrophy or small aneurysms, that's like revving a sports car engine in a tiny Mumbai parking lot. Something's bound to scrape. So what's the fix? Don't ditch strength training, upgrade it. First, use lighter weights, about 50 to 60% of your maximum. If your weight feels moderate to challenging, but you can still breathe steadily and talk a few words, that's safe. If you're grunting, holding your breath or seeing stars, that's 90% plus, that's too much. Second, go for 12 to 15 controlled repetitions, not 6 grunting ones. Third, never hold your breath while lifting. Breathe out when you push, lift or press and breathe in when you release. Let your heart work with you, not against you. And finally, rest 60 to 90 seconds between sets to let your blood pressure settle. Now, if you're new or nervous, start with resistance bands, wall push-ups or body weight squats. They give almost the same benefit with far less stress. And remember, strength training for BP isn't about showing off how much you can lift. No ego weights, please. It's about how long your heart can keep lifting you. Think of it like Pani Puri. The first one is delicious, the second is fine, but if you go all in with 10 Pani Puris in one breath, the system revolts. Same with weights, pace yourself. Now let's talk about the rage of social media. HIIT workouts, CrossFit, Tabata, boot camps. You've seen those reels. Dim lights, loud music, six-pack trainer shouting push, push, no pain, no gain. It looks cinematic, but for a person with hypertension, it's sometimes more ICU than HIITU. Now here's the truth. High intensity interval training can be fantastic for fitness, but only when your heart is ready for it. These workouts push you to 80 to 95% of your maximal effort. Short, explosive bursts followed by quick rest. Now what happens inside your body? Now when you suddenly sprint, jump or push hard, your arteries clamp down, adrenaline surges and your heart starts hammering. Now BP can shoot up 40 to 60 points in seconds. Again, that's fine if you're a trained athlete or a 25-year-old fitness influencer. But if you're a 45-year-old office warrior who hasn't stretched since last Diwali, it's like taking a Ferrari on Mumbai's pothole-filled roads. Sure, it will move fast once or twice, but try it daily and you're asking for trouble. Studies have shown that structured, gradual aerobic training like walking, cycling or swimming consistently lowers BP by 5 to 8 millimeters of mercury, but unplanned intensity spikes can trigger arrhythmias, dizziness or even chest pain, especially if you're on beta blockers or BP meds that blunt your heart rate response. But if you love variety and intensity, that's good news. You don't have to give it up. You just need to be strategic. Now try the Japanese slow fast walking method instead. 3 minutes brisk, 3 minutes slow. It's been tested in hypertensive adults and it has lowered systolic blood pressure by around 8 millimeters of mercury in 12 weeks. No fancy gyms, no injuries, no drama. Or try this. Alternate days of moderate walk plus light cycling plus gentle strength. That way your heart always stays challenged but never shocked. So yes, you can enjoy intensity, just treat it like your BP medicine. Start small, build gradually and never overdose. Now here's a question I get all the time. Doctor, I do yoga every morning. That's always safe for blood pressure, right? Well, mostly yes, but not always. Yoga is one of the best tools to calm your mind, reduce stress hormones and improve flexibility, all of which help lower your blood pressure. But just like medicines, it's the dose and the method that matter. See, when you do certain poses, especially inversions like Shirshasana or the headstand, Sarvangasana or the shoulder stand, or Halasana, that's the plow pose, you're literally flipping your circulation upside down. Now blood rushes to the head and neck. In healthy people, that's fine for a few seconds. But if you already have hypertension, fragile vessels or early eye or brain vessel changes, that sudden upward surge can spike pressures inside your head and eyes. Now that's why patients with high blood pressure, glaucoma or aneurysms are advised to avoid prolonged inversions and breath holding poses. So what's safe and super effective for BP? You focus on restorative grounding yoga, things that make your body and breath move together. So try Vajrasana, that's excellent post-meal digestion and calm focus. Second is the cat-cow stretch or the combination of Marjariasana and Bitilasana. It gently opens the chest and improves circulation. You can try Balasana, that's child's pose, one of the most soothing for mind and body. And finally Shavasana, but it's not Napasana, don't sleep here, but it gives real body relaxation. And for breath work, skip the aggressive Kapalbhati or Bhastrika if you are hypertensive. Instead, go for Anulom Vilom, Bhramari or slow, simple diaphragmatic breathing. These activate your parasympathetic system, releases nitric oxide, slows your heart rate and lowers stress-induced spikes. Now, slow exhalation lowers sympathetic tone. It reduces blood pressure by 3 to 5 millimeters of mercury in just 5 to 10 minutes of practice. Regular yoga practitioners have up to 20% lower stress hormone, that is cortisol levels, than sedentary individuals. Now let's shift from gyms to the great outdoors, adventure sports. Because at least once in life, someone with BP has said, Doctor, I'm fine now. Can I go skydiving? Maybe a quick bungee or a trek in Ladakh. Another one saw Zindagi Na Milegi Dobara and asked me if he could go for the bull run. Sounds thrilling, right? But here's the thing. What's thrilling for the mind can be terrifying for your arteries. So let's understand why. When you are bungee jumping, skydiving, skiing, scuba diving, or trekking at high altitude, your adrenaline shoots up. It's the body's fight or flight mode. Your heart rate doubles, arteries tighten, and BP can rise instantly by 40 to 80 millimeters of mercury. For someone with stable BP, this spike settles. But for someone with hypertension, blocked arteries, or an enlarged heart, it's like putting a turbocharger on a 15-year-old Maruti. The risk isn't the jump, it's the sudden surge. Add to that high altitudes and cold weather that naturally raise blood pressure. The air is thinner, oxygen is lower, and your body compensates by tightening blood vessels. So if your BP is already high, you don't need bungee to feel your heart drop. Your medical bill will already do that. Does that mean no adventure ever again? Not at all. It just means plan it smart. Get your BP checked and stabilized before you travel. Avoid extreme altitude, that's about 10,000 feet, until your BP is well controlled. Stay hydrated. Dehydration worsens BP at high altitudes. Carry your medicines and a digital BP monitor. Yes, they work up to moderate altitudes. And for adventure activities like bungee, scuba, skiing, get a fitness clearance and avoid them if you've had a recent heart, brain or kidney issues. And if you decide to try, start small. Small treks in the Western Ghats, great. But hanging upside down in Rishikesh, maybe wait till your cardiologist high-fives your numbers. So now you know, strength training, HIIT, even certain yoga postures can raise your blood pressure instantly if done wrong. But wait, does this mean people with hypertension should avoid exercise altogether? Absolutely not. In fact, the right kind of workouts can protect your heart for life. In part 2 of this series, I'll share you complete hypertension friendly exercise toolkit. From walking and cycling to yoga and even isometric hand grip training. You learn exactly what to do, how much and how to make your heart stronger without stressing it. So like, share and subscribe to our channel and don't miss this next video as it could change the way you exercise forever. Goodbye and take care.